Good day, people. We're here to talk further about patient positioning. So in the previous video, we spoke about the first concept, which is the table makes stable. And we displayed that not only with the shoebox, but also with an actual patient example to try to illustrate it in multiple ways. So here we're going to talk about the second concept of patient positioning. Now, the second concept has already essentially been spoken about within that first concept. So the table makes stable, and we spoke about the amount of contact surface. So the amount of contact surface with the table is what creates that stability. So the second concept is essentially that less table equals I need to make the patient stable. Okay, so just a little catchphrase. Again, less table means I as a practitioner need to make the patient stable. So we spoke about the reality of different positions, so prone and supine being the most contact surface the patient can have with the table. That means they're the most stable. So again, the table makes stable. Put the patient in lateral and you've changed the amount of contact. Put the patient in seated, you again change the amount of contact surface between the patient and the table. So less table means I need to make the patient stable. So essentially what we're going to look at here is the reality that as the amount of contact the patient has with the table changes, I need to create the stability to improve patient control and patient safety. So we're going to move on to look at some examples of that. We're going to show you what that means and how to achieve it. So when you take a patient from prone or supine and put them in lateral or in prone, there are various ways to create more contact. And we're looking at the concept that less table means I need to make the patient stable. So here we are to talk about the second concept, which is less table means I need to make the patient more stable. So the patient's in supine, the most stable position as we spoke about in the previous example, the previous concept. So the patient is very stable. I can shake him, he's stable, we've got no issues. I put the patient on his side, so on your side facing that way. Keep your legs straight for me. Okay, so we spoke about this with the last video. The legs are straight, movement is not abated by the legs, the patient is unstable. I can make the patient more stable. So what I do is I approximate the patient, I get close to the patient, I create body contact. We'll talk more about this in the next video, which is the concept, the third concept, that the space between us is unstable. So bridging that space, removing that negative space to the best of our capacity helps. But the patient is in a very unstable position here, but I can make him more stable. So if we look and compare how he's rocking here, right, how I'm rocking him, so I could rock him in a different way. To control that, I can create body contact. These are things that I can do to make him more stable. Now, one of the other things I can do to make him more stable, which we already talked about, was having him bend his knees or bend his legs. So now the position of the legs with respect to the thorax abates motion. So he becomes more stable again. So that's something I can do to make him more stable. I can make him more stable again with body contact. Sit on up for us. Okay. Just move down over here a little bit. Okay. So now the patient's sitting up, and we understand from the previous video that the seated position tends to be the position where the patient is the least stable. There's the least surface area in contact with the table, so he's the least stable. Go ahead, shake him around. There's an issue with stability. I can move him around, as long as he's relaxed. Most people won't relax as much as a very good guy. What we end up doing, again, less table means I need to make the patient more stable. So the way that I can do that is how I move the patient, or how close I am to the patient, how much contact I have with them, which again is for the next video, the next concept, which is the space between us is unstable. And so we remove negative space, but the way that I interact with the patient is how I'm going to control that. So again, less table means I need to make the patient stable.